Hi, it's Marty Manning. I'm at Scottsdale Medical Imaging with Dr. Dan Maki, who's a radiologist. He is a specialist in breast imaging, correct?
That's correct.
All right. Now, what that means is he knows a lot about mammograms. And what's the most important thing you can tell people right now about mammograms?
Well, the most important thing is that early detection is the key. Breast cancer is very common. It's the second most common cancer in women, second only to non-melodonic skin cancers, rather. And but it is associated with a lot of morbidity and mortality in women. It's the second leading cause of cancer death in women, second only to lung cancer. But the good news is that early detection is the key, and it's a very treatable and easily curable disease if it's caught at a very early stage.
That's the important thing, that early stage. So what age would you say women should have their first mammogram?
Well, the American College of Radiology and the American Cancer Society have been steadfast in recommending screening mammography annually beginning at age 40.
Annually is an important thing. You don't want to be skipping years.
Absolutely not. And there's been a lot of debate in the news lately, and most of that has been related to cost effectiveness. None of the debate has had anything to do with whether or not it's truly saving lives. It truly saved lives, and all the studies show it saved lives, probably 30% reduction in mortality in lives, even in the 40 to 49-year age group.
Suppose a woman says, but there's no history of breast cancer in my family.
Well, about 75% of breast cancers that we see are what we call sporadic cases in people who have no family history. So although it's important to know if somebody has a family history, it definitely occurs in people who have none.
What about mammograms and MRIs?
Well, MRI is an important adjunctive imaging tool in breast imaging, and it's a very useful problem-solving tool. We use it for staging people who have a known cancer. We use it for problem-solving in people who have lumps that can't be seen on a mammogram or an ultrasound, but it's not a screening tool for the general public. It's useful in high-risk populations, but it's not a screening tool for everybody.
So there you go. You heard the doctor. Age 40, get a mammogram, get one every year. And of course, Scottsdale Medical Imaging is the place to get it.